Hello and welcome to The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer. I am thrilled to have my friend and my dentist, Dr. Stephanie Sommer, joining us today. We have known each other through grade school and high school, and we've crossed paths at least a few times during some of those years to hang out. Dr. Sommer practices in and owns Versailles Dental. She has been practicing dentistry for over 20 years, and she's received her bachelor's degree from Defiance College.
Yep.
And her doctorate of dental surgery from the Ohio State University.
Go Bucks.
She is married and has 6 kids. This girl stays busy. I have observed her attention to detail and her drive for success for many years. She has had advanced continuing education with Dr. Gahari with the Oregon Clinic for Tethered Oral Tissues. And she has also studied under Dr. Gregory Notestein, a pioneer in tethered oral tissues. Today, we are going to be discussing tongue ties, how they affect the young and the old, and how to correct them. Steph, it is so good to have you here today.
It's great to be here. Thanks for asking me.
I seem to recall that you wanted to be a dentist for at least the majority of high school. What drew you to dentistry?
I've actually wanted to be a dentist since 3rd grade, even though it wasn't like the cool thing to do. Obviously, everybody wants to be like a teacher or a princess. I wanted to be a dentist. So I always think of the movie, the Christmas movie with Hermie, the dentist. And so that was kind of me. I always wanted to work in healthcare. And for some reason, dentistry just fit as far as having the work-life balance, being able to be a mom. So it just was the perfect fit.
Awesome. You made quite the impression on me when you were in dental school. A few of my friends and I, we were going on a trip to St. Louis, and, we're college students, we're cheap, and so you agreed to drop us off at the airport so, we could avoid our parking fees. But you gave us a care package. Do you remember that?
I do not. This is great. It's going down memory lane. Please share.
So, of course, since you were in dentist school, you gave us a care package. And, of course, it was, the normal thing that you might get from the dentist. It was a toothbrush, and it was a little bit of toothpaste and some floss.
Very good.
And you specifically told us to remember on our trip to clean, to make sure we keep up with our oral hygiene.
Absolutely. Yes. That's a true friend, caring about their oral care and their oral health.
I was just blown away. And I had that. I bet I had that bag you gave us for multiple moves. Because I remember every time I saw it, I'm like, oh yeah, Dr. Steffi gave that to us when we were traveling. And I don't know, it's just, I loved how you were so dedicated to your field at, already, even though you weren't in the field yet, you're still studying. But it just made an impression on me. And
I love that.
I don't know, in the chiropractic field, we don't really give goodie bags too often. Maybe a bag of spines at some point, little bones or something. But I don't know, it just made an impression on me.
Oh, I love that. It is so true, though. Like your oral health has so much to do with your overall health. And so it is nice how it kind of parallels with, again, spinal care and chiropractic care and a lot of other health professions. It is truly, I feel like, the gateway of your health.
So you have done a lot of training with tongue ties. What piqued your interest and made you aware of them?
Yes, actually, it was my patients. So they started asking me about it, talking about it. And we do have a lot of patients that are kind of more natural and want to live their life in their healthcare, but also in their personal life. And I kind of dismissed it, to be honest, at first. In dental school, they kind of don't a lot of time towards that. Back in the day, it was just like, oh, especially if you had a lip tie, oh, they'll fall, it'll rip on its own. And so we had very, very little knowledge, information on it. And then another thing that kind of piqued my interest was that when you start seeing oral issues in people's mouths and you don't know how to treat it, is super frustrating. Because I think as a healthcare provider, you want to be kind of like that detective and figure everything out for them. And so there were certain conditions that we just didn't understand. And so I went to Dr. Gregory Notstein's office in Dayton. He is a guru, has written articles. He's just phenomenal, and spent some time with him, and my eyes were opened. It was just amazing. And so you don't see what you're not looking for, and you don't know what you don't know, kind of thing. And so once I had the knowledge, it just opened up the world. I'm like, I want to know more and learn more, because this is just so important.
So what is a tongue tie?
Yeah, so a tongue tie is essentially a band of tissue that tethers the tongue to the floor of the mouth. And I should almost kind of back up a little bit. So a more all-inclusive term would be tethered oral tissues. And so that's what we're kind of dealing with. So we deal with lip ties, we deal with cheek ties, and we also deal with tongue ties. But typically when you're talking to people, you just say the term tongue tie, and that kind of correlates to like all of the tethered oral tissues in a person's mouth. And when it's an issue and when it's actually restricting, that is when we kind of have to go ahead and intervene.
So how often do they occur?
Good question. There is a lot of research out there, and it does vary quite a bit. So I would say a lot of times they say between 4 to 10% would be about average. Other research has said at least less than 25%. So I would say anywhere between 4 to 25%, which is kind of a large range. But I also think it can be varied based on where you're located in the world, or even a region in America. I do feel like the genetic factor is huge.
Well, the tough thing with figuring out prevalence is not everyone's tested. And so you're kind of trying to take a sample from a study and then use that and expand that to determine how much the population is affected. But even that sample is not necessarily going to be uniform throughout, a region, or certainly throughout a country.
Yes.
And so I think
that really makes it varied. Absolutely. And sometimes we'll get emails at the office and say, hey, can you fill out this survey? And they're asking us questions like, how often are you releasing a cheek tie? How often are you seeing things? And so they're just taking my own personal data and running with it, essentially.
And your numbers are going to be skewed a little bit because people are going to seek you out because of that. So
yes. So my numbers will obviously be higher because, yes, people are coming to me directly for that procedure.
I found kind of that 4% was the low end of it as well when I was doing my own little Googling.
Yes.
So when you have a tethered tissue, what does it affect?
Oh, so many things. I could go on forever about this, but I did write some notes, and Aaron did make fun of me a little bit since we're high school friends about my notepad here. But it's one of those things, it just affects so much. And I want to make sure that we reach out to everybody. If you're having one of these signs or symptoms, I think it just behooves you to just get evaluated, just get checked. So some of the 4 major things that it affects is breathing. Amazing when let's say your tongue especially is tethered to the floor of your mouth. You tend to have more of an open mouth posture. You tend to be more of a mouth breather. We should be using our nose as much for eating as we use our mouth for breathing. So that's basically not at all. We should be using our nose. We should be, using our nose. And the reason God put our nose there, it filters the air, it warms the air, it moistens the air for us to breathe. And so when we're breathing through our mouth, that also can inflame our tonsils. And so it really does kind of snowball. So all of these conditions, it's not just, it affects this, it's the snowball effect that occurs as well. Feeding issues. Feeding is huge. And we definitely see a lot of infant tongue tie patients because of feeding concerns. So they have to work harder. Sometimes they're using other muscles like their cheeks and their lips to do the feeding versus their tongue. So they fall asleep early. They don't finish their feeds. They're not getting the hind milk. They now have low birth gain weight of their weight. So there's just a lot of things that, again, snowball from that. Speech can be an issue. If your tongue is tethered to the floor of your mouth, you're not able to pronunciate or enunciate the words that you need to. So sometimes we're seeing those children come from, especially if they're seeing a speech therapist or pathologist, seeing someone like Help Me Grow. Sometimes they're like, hey, they're not being able to make those sounds. And so they send it our way. Sleeping is another issue. So if your tongue is tethered to the floor of your mouth, you have mouth open, it can even affect the way you sleep. Pain that we see, especially more in adults, when they aren't caught early, they have a lot of neck pain, shoulder pain, migraines. So it kind of affects so many things that you just would never realize.
And what I find interesting is it affects more than just the young. It could be something that compounds for many years in the future.
Absolutely. And from the dental perspective, it really affects their teeth as well. So if they have, let's say, a lip tie, they're not able to brush their teeth as well because they're banging into that tissue and it doesn't feel good. So they're not bringing their toothbrush all the way up to their gums where that junction, which is so important to clean. Another reason that we have dental issues is if they're tongue-tied, they can't take the tongue and kind of clear the food from the back of their teeth. And so they tend to get more cavities back there. Their mouth tends to be more dry because they're mouth breathing, and so they have more gingivitis or bleeding gums. So again, it just affects so many things.
Wow, I had no idea.
Yeah.
And you mentioned they can fall and they can be self-limiting. And so
for sure.
Sometimes they will tear, and but apparently if it lasts into adulthood, obviously sometimes that tissue is strong enough it never tears.
Yes, and I would say the majority don't tear. So that was just very poor advice back in the day. And if it does actually release on its own or by a child falling, they're not going to actually release their tongue tie. It would only be a lip. And then even if they do release their lip, a lot of times it's not a full release. It's, again, a partial tear, essentially. And sometimes you'll see on patients, they'll have like a little funny piece of tissue by their top lip. And that's usually because, again, that tissue wasn't released in an ideal location. It just was, again, released wherever they fell, kind of thing. So it's not ideal.
My son had a tongue tie. He had some latching issues when he was breastfeeding. Shortly after being born, they had already noticed it. And then nurses had suspected a tongue tie. And they gave us a list of people locally of who to contact to possibly get it corrected. And your name is on the list. Which we were super excited about. We're like, we already know who we're contacting. So that was a really easy decision. And so at 10 days old, you did the procedure to correct his tongue tie. And we immediately saw a difference in his ability to latch when breastfeeding. And it was... For Angela, it was a night and day difference in how that experience was and how it seemed on his end as well. And we've discussed how there's so many women that they want to breastfeed and they have difficulty. And especially when you're a first-time mom, there's going to be a lot of difficulties. We're not born knowing exactly how that's all going to work. And so even though it's a natural behavior, like you still have to learn. And how many women possibly abandon it early because possibly there could be some form of a tethered tissue issue that is causing there to be difficulty with breastfeeding. And so they abandon something that maybe they wanted to do and they were really felt strongly about because they're just having either too many issues or maybe the baby wasn't seeming to gain weight at the speed that was expected. So what's the process you go through to determine if there is a tongue tie?
Good question. So I would say the first thing that we need to do is a clinical exam. What we do is we typically have if it's an infant or a small child, we do what we call a knee-to-knee exam with the mother or father or grandparent, whoever brings them in. And so their little head will be in my lap, their toes will be pointed away. And what we do is we evaluate the lip, we evaluate their cheeks, we evaluate the roof of their mouth to see if it's like a high palate or not. We look at the tongue to see if it's coated. We look at the underside of the tongue as well. And so we do a very thorough clinical evaluation. And we're really looking at, especially with the tongue, since that is usually the main culprit, I would say, of issues, we're looking at what kind of movement are we getting? Is it limited? Is the mid-body of the tongue being restricted and not being able to fully function like it needs to? So the clinical exam is a huge portion of it. And so again, if your hands are in that baby's mouth or child's mouth and doing a thorough evaluation, you can't just guess. I know back in the day, they said, oh, can you stick your tongue out? And that was like, oh, if you can't, then you're tongue tied. If you can, then you're not tongue tied. And that is just very poor, again, diagnostics. So what can happen is you can still maybe sometimes stick your tongue out, but you're lifting the floor of the mouth. So actually the tongue is not moving per se that much. It's the floor of the mouth. So it's compensating. So there's a lot of compensations, and you have to be able to diagnose that kind of thing. So clinical exam is one. One of the bigger things is actually looking at symptoms. So when we are evaluating a child for a tongue tie release or tethered oral tissues, there is a lot of paperwork, and we spend almost a half hour to an hour just going over a lot of the different symptoms. And so I did write them down, so I am going to use my notes for this, just because there are a lot of symptoms, and I want your listeners to understand that, like, oh, I didn't realize that. So I don't want to skip too much, just because there's a lot, and we have, again, a huge intake paperwork. But a shallow latch is one of the easier symptoms that we're looking for. If they fall asleep at the beginning of the feeding, I kind of alluded to that before, where they tucker out. That tongue is supposed to be doing the majority of the movements to be able to transfer milk, whether it's breast or bottle, to baby. And so if that tongue can't do what it needs to do, it's compensating. They're tuckering out before they actually finish feeding. If they are colicky or reflux, that can be a sign or symptom. If they're clicking when they're eating or smacking, that is another huge red flag for a possible tongue tie. Poor weight gain for sure is one. If they're gagging, choking, that could be potentially one, but sometimes that's just heavy letdown. So when we're doing our evaluation, we're really looking at, okay, is this from a tethered oral tissue, or is this some other kind of thing going on? If their lip wants to curl under and doesn't want to flare, that can be a lip tie versus a tongue tie. We're looking at, is milk dribbling out throughout the whole entire feed? Obviously, they don't have a proper latch. And if they're snoring or mouth breathing, those are some other diagnostic, questions and things that we're looking at.
Falling asleep, that's a really fascinating thing that it makes them tired. But, I've heard many times, they never said it when I was in chiropractic school, that the tongue is the strongest muscle in our body. Yes. I don't know if there's the truth or merit to that, but, yeah. I can believe it. And so if you're taking the strongest muscle of your body and you're inhibiting its ability to function correctly, other muscles have to work significantly harder to compensate for that.
Absolutely.
It's just really fascinating.
It makes sense. Once you kind of understand it, you're like, oh yeah,
And we're trained, or I shouldn't say trained, we grow up with this idea that it's natural for the baby to fall asleep during breastfeeding, which, at the end is perfectly fine. But I think oftentimes that could be confused, because the baby falls asleep and they're like, oh yeah, the baby's just, got its needs met, and, and everyth's good, when in fact, possibly it's not good. Baby's not getting its needs met, but it's just so darn tired that the baby falls asleep.
Correct. Absolutely.
It's really fascinating. So I imagine there's different types or grades of tethered tissues.
Oh, I'm glad you're asking that question. Yeah. So I kind of feel strongly about this question. There are definitely different systems out there. Kotlow is probably the most common one, where they grade a tongue tie, and it's either grade 1, 2, 3, or 4. I actually do not like grading tongue ties. I think it's a poor system, just because you can actually have a more mild to moderate tongue tie, but it's actually inhibiting the function. And so if we're taking that functional piece out of it, then there goes the whole diagnostics. So we really need to look at function. So again, it could have a very mild to moderate tongue tie, but causing a lot of functional issues, and vice versa. So on the flip side of that, you can actually have a very complete or severe tongue tie, which would be typically a class 4 if you're to actually classify it, but they could actually be compensating. So even we see babies with complete tongue ties able to nurse fine, gaining weight fine, doing all these things fine. Now, do we still recommend a release? Absolutely. We're actually looking at then in the future, like breathing concerns and speech concerns and things like that. So it still does need to be addressed, even though baby is compensating. So again, that's why I typically don't like to grade the tongue ties.
It's interesting. I had speech training, and I'm sure everyone that knows me, I have a little bit of trouble with my S's. I have a little bit of a lisp, which, why they have an S sound in lisp is just torture.
It's just cruel,
But, since my son had a tongue tie, it ever since then, it's made me wonder, like, did I or do I still have a tongue tie? Speech is a learned behavior. And so you learn to work with whatever you've got. And so I hate calling it a speech impediment because it's just me at this point. I'm not impeded in any way necessarily, but I've often wondered, like, is that possibly why I struggle? Because I had to do speech class from, I don't know if I started in kindergarten, but certainly in first grade I remember doing it. And went all the way through fifth grade. So, it's 5 years of that. And had to get pulled away from class for whatever the time was, 15 or 20 minutes, So depending on when it pulled me away, I may have struggled with some education aspects of learning in the classroom. There's all sorts of things that may have affected me. And, I'm really happy my son got that. And, of course, we always pay attention to our kids and the things that maybe we are insecure about with ourselves, and so that's always something I've always paid attention. How does his SS sound like? I would like him not to have that, and so sure. Perhaps you helped him with that, and
I hope so.
Awesome.
Yes.
So yeah, just a little antidote there. So, what are the options available to correct, whether it's a tongue tie or another tissue tether?
Mm-hmm. Yeah, so there's three main options that you can use to correct a tethered oral tissue. So option number one is a scalpel. Most don't use a scalpel anymore. I feel like you have a little bit less control with a scalpel. You can get a full release with any of these options. Some just are more difficult than others. With a scalpel, you tend to get a little bit more bleeding, and that you definitely want to do in a hospital setting or a healthcare setting where they're able to, be able to take care of any potential post-op complications. Another option besides a scalpel would be a scissors. And so a scissors release, again, you can get a complete and a full release with a scissors. Again, sometimes just a little bit more difficult. And as time goes on, we're pretty much at our office exclusively doing lasers. So that's kind of the latest and greatest. So we have both a diode laser in our office and a CO2 laser. And with that, we've found that not only are you cutting the tissue with that, just like you would a scalpel or scissor, but it also cauterizes the tissue. So you get a lot less bleeding. So it's a lot easier on the parents to be able to handle anything afterwards, because if you see your little one bleeding, again, that's very concerning. So if we can cauterize that, and it is typically more comfortable too with a laser, and we tend to get better and quicker healing with that. So we pretty much exclusively use a laser now.
I know with our son, you use, I'm almost positive you use scissors.
I did. Was that 6 years ago?
Yep.
Yeah. Mm-hmm. Yes. Mm-hmm. So things have changed.
And for him, at least, I don't think there's much of any bleeding. And he didn't even make a whimper when it happened. It was a very quick process. And we had asked you about lasers at the time, and what you had said for his particular case was it's probably not necessary.
Correct.
But I do remember doing our own research and ahead of time and seeing a lot of talk about the laser at that point, and
it really depends on the tethered oral tissue. Is it real thick? Is it real kind of meaty? Is it real thin? Is it sometimes when you lift up, especially the tongue, you can see almost through the other side of the tissue. It's very, very thin, and there's not a lot of nerve endings. There's not a lot of blood vessels. So in those cases, you could absolutely use a scalpel, absolutely use a scissor. Again, if it gets a little bit thicker and a little bit more posterior, that's when the laser really shines.
So healing.
Yes.
what's the process of healing after
Yes.
undergoing this?
Absolutely. So I think that's also one of those things that now that we know better, we do better over the last few years. So post-op wound care is absolutely incredibly huge when we're talking about tethered oral tissues. There's actually a lot of instructions that we give after release to make sure that we're guiding the healing properly. So we are actually having them do like the therapy or the stretches in order to, again, guide that healing. So if you think about typically when you have a wound, let's say a cut on your hand, your body wants to heal that wound together. So that's the exact opposite of what we're trying to do when we're actually releasing a tissue. We're releasing it. We don't want it to heal back together. We want it to heal, again, separated. And so that's where the parents come in and start doing the exercises. At the office, I always give the example, just like if you had shoulder surgery, the surgeon wouldn't be like, okay, great, you're good, have a great life. They'd actually probably send you to a physical therapist or some kind of therapy to make sure you gain full range of motion of that shoulder, just like we want to gain full range of motion of that lip, of that cheek, of that tongue kind of thing. So when we have our patients do the stretches, it's about for 4 weeks. So it's quite a long time, and they're doing the stretches about 4 times a day, again, in order to guide that wound healing.
Interesting. Mm-hmm. I imagine you gave us those.
6 years ago.
Yeah,
you don't remember those?
I am guessing Angela handled that and not myself, because I do not remember that at all. But Abbott seemed to turn out pretty well.
Absolutely.
So, you're obviously experienced. You're good at what you do. So when I witnessed the procedure, it seemed super easy, mm-hmm. Which is always a sign that you know what you're doing. It shouldn't. If you're observing someone doing something, they seem like they're really struggling, then they don't have a lot of experience yet with doing that.
Absolutely.
So I was a little nervous going in of what that process is going to be like, and was very happy when it seemed pretty easy, at least on my particular side of things. So what are some other therapies possibly that someone could consider?
Yeah, so I love that question. And again, I have a list of different providers that we like to collaborate with and work with because it's so incredibly important. In an ideal case, every child or adult that we see would actually have therapy before release and actually after release. And so we work with a lot of different healthcare professionals, and they all kind of give their special twist to the patients that we see in order to get better and more better healing and just better results, essentially. So I did make a list of them. Again, I'm going to use my little notebook because I don't want to leave anybody out, because again, we do utilize these people so much and they're so incredibly important. I think a lot of times the first line of defense is our lactation consultants, for sure. So a lot of times they're seeing them at the hospital, but not always. And so you can either continue to see the lactation consultant at the hospital, or there are definitely private ones out there that are absolutely amazing that you can work with to kind of help. Because sometimes it isn't a tethered oral tissue; it's just positioning of the infant, and so working with them is sometimes the first line of defense. Another group of people that we like to work with for sure is like feeding therapists. They are just amazing. It's wonderful what they can do and help in order to be successful. Other ones are chiropractors, so we work with chiropractors a lot. A lot of times, if we can get things kind of aligned, it's a bumpy road coming out of the birth canal or through C-section, and so a lot of times, if we can kind of get things aligned and we do a release, we actually like them to see a chiropractor afterwards, always, if possible, just because, again, that can help, again, guide that healing. If they had some tension, especially in their neck and their shoulders, again, that chiropractor can kind of come in and help, again, release some of that tension and just have baby overall happier and sleep better, which is every mother's and father's dream. Other people that we work with are physical therapists. Myofunctional therapists are huge too. So myofunctional therapists, if you don't know them, they're not maybe as common. They work with the muscles. So it's kind of retraining those muscles to do what they need to do in order to be successful. We also work with craniosacral therapists who are huge, and also massage therapists. So we've really seen a lot of benefit from working with all those other professionals.
I can speak on the chiropractic side. The number of babies that we will take care of, and we don't take care of a lot of babies in the office, but when we do, one of the things that's oftentimes reported when they have a spinal misalignment is the baby only wants to feed from one side. Mm-hmm. And most likely that's because there's some form of misalignment to the spine, and it's uncomfortable to get in that position to go on the other side. And so that's one of the most common things we hear from mothers, parents, after their baby is adjusted, is they are suddenly feeding on both sides and willing to feed on both sides. So it's definitely something to look at for parents if they notice the baby's only feeding on one side, that there could be a misalignment happening that's making that happen. So, it's interesting to pay attention to the signs. And we oftentimes, as parents, we might just pass it off as, well, this is just the baby's preference. It's just the baby's preference to be on this side. Well, there's probably a preference too, but when they refuse to do the other side, or they are always falling asleep, those are signs that maybe something is not quite lining up properly and it just needs to be addressed.
Yeah, for sure. Even if they're crawling and they're having a preference of just rolling on or crawling, just their gait is a little off, or if they're rolling just on one side versus the other, just those little things that you can pick up as a parent to where it's like, hey, maybe we need to go see the chiropractor. Maybe we need to go, see somebody to just make sure that everything's okay.
The pre-therapy, I'm very fascinated in that. So what are they doing ahead of time for therapy?
Yeah. So sometimes infants come like straight from the hospital. We've had moms come in right away just because they're so tethered that it's going to be really difficult for mother's milk to come in. It's really hard for any kind of feeding because they're so tight in there. And so in some cases, just therapy is just not an option. We need to go ahead and get the release and then go seek therapy afterwards. But if there's any concern, a lot of times pre-therapy is wonderful. It can kind of just help elongate the tissue a little bit and kind of get the baby ready for therapy. So we've definitely found that to be incredibly helpful.
Do you have any tips or suggestions for, I like to call them our super fans, our listeners, that they can implement in their lives pertaining to their health, pertaining to dentistry, if you want to go there, pertaining to tissue tethers?
Yes. So I would say, first and foremost, listen to your gut. I think that is, if you don't know what you don't know, like we kind of said earlier. So there are definitely all kinds of professionals out there, whether they're doctors or nurses or even lactation consultants. If they are not open to it, and if they have not been trained on it, you don't know what you don't know. And so you might have somebody that you trust and love that says everything is fine. And then something in your gut says, oh, this just doesn't feel right. Get it evaluated. And once you have your experience, feel free to share. It's one of those things I think that's hugely helpful. How many times we see patients come in because, oh my gosh, you saw my nephew, you saw my niece, you saw my neighbor, and oh my gosh, what a difference that made. And that can just be absolutely huge. So go ahead and follow up and listen to your mom gut. So I'd say that'd probably be my number one piece of advice. So if you want to go into dentistry, I've got tons of things. I would say floss your teeth, please, people. Like, especially with kids, as we're kind of going on the kid and baby area. We get something stuck in our teeth and drives us nuts. Like you have a piece of meat or something, you got to get it out. Little kids, they really don't feel when there's stuff stuck between their teeth. And so please help them floss their teeth before they go to bed. We have like funny little things that we say in the office all the time, like only brush the teeth and floss the teeth that you want to keep. So if you want to keep them all, then you got to brush and floss them all. Our other little sayings that we kind of have at the office, because we do see a ton of kids. Brush your teeth in the morning to keep your friends, brush your teeth at night to keep your teeth. So sometimes those little antics kind of hit home. So we like to say things like that. As far as kids go, we really don't like gummy vitamins at all. We would prefer if you need a supplement with some kind of vitamins, we like spray vitamins, liquid vitamins, more the Flintstone kind of chalky vitamins. They're less sticky to the teeth. Mm-hmm. We really try to tell our patients to stay away from like gummy snacks. I would rather you almost give your kid a Hershey Kiss than a gummy snack, because a Hershey Kiss will like dissolve and melt and doesn't get stuck in the teeth. And prevention is everything, I feel like, not only with tongue tie releases, with dentistry. If prevention is just the way to go. And sometimes we always have our women in the office like, how do I talk to my husband about this? And I say, relate it to me with our car. It's like prevention. You got to get the oil changed, you got to get the tires rotated, or even your house. Prevention is huge in most things in healthcare.
I think the first thing you said, listening to your gut, is huge. And I'm also a big proponent on, if you have that gut feeling, you go and you talk to somebody and maybe they dismiss it as not a big deal. If your gut's still screaming, like, go talk to somebody else, because maybe you're just not talking to the right person that quite, maybe they didn't, maybe how you're talking to that person, you're not communicating that message in a way that's really clicking in their head, you know, because we can say the same thing to two different people and they will hear something different. And so sometimes it's not even that, maybe it's not that they don't know, it's just that the words you're using are not sinking in correctly for that person. And so I think it's really key to listen to your gut. And if your gut's saying something's wrong, keep working until you find that solution. Prevention, as you said, is certainly key.
Yeah.
But those are really great tips. And I love the entire brushing your teeth in the morning, keep your friends, because you've not said that one yet that I've heard. But
because you brush and floss like you're supposed to, so I don't have to.
But we're going to use that in the household because we do have a little one that sometimes doesn't want to brush in the morning. So
yeah, use that. It's a good one. Kids get that. They want their friends, especially at school. So yeah.
Use a little bit of fear as motivation, maybe.
Fear, humor, bribery. You know, as a parent of 6, you have to use all of the tricks in your bag sometimes.
So I do appreciate you being here today.
Thanks for having me.
Do you have any closing thoughts or additional things you'd like to share?
Oh my goodness. Yeah, again, I think you've really hit on them. Like, again, prevention, listen to your gut. It's amazing what our bodies are screaming at us, or even sometimes whispering at us. And those are the harder ones to listen. But seek. It doesn't hurt to get a second opinion or a third opinion. And no one takes care of like your health, or I don't know how. Sometimes I say this probably more to moms than anything, where it's just like, you have to take care of yourself. You can't fill from an empty cup. So take care of yourself.
Yeah, absolutely. You know, that when I keep going back to breastfeeding, but breastfeeding is such an important part of our, as children, as babies are developing, it's so important. Obviously, there's a connection happening between mother and child, but there's all sorts of studies showing how kids are healthier, both as infants and as growing children from when they are breastfed. And they're I don't know how the studies necessarily figure it out, but IQ is higher. Mm-hmm. I've always wondered about that, if IQ is actually higher from breastfeeding, or if it just, there's a socioeconomic thing that's maybe happening as well. But, the studies indicate that kids do better when they're breastfed. So if
Absolutely.
they are having troubles, and I know we're talking, today's podcast is more about than just babies, but that's where we most talk about tongue ties or your tissue tethers.
Yes.
But getting those corrected, you can set your kid up for success.
Yes.
And I'm all about setting kids up for success.
Yes, to be the best version of themselves.
Absolutely.
And to kind of piggyback with what you're saying, because again, I'm so passionate about so many things, and breastfeeding is one of them. I will say, I love to tell moms a fed baby's best. So we always say that first, a fed baby is best, because we don't want any shaming going on if for some reason the breastfeeding journey is not going on. Now, is breastfeeding the best? Absolutely. We do understand that it's preferred, that skin to skin contact, moms slowing down and just taking time to sit and feed their baby, because we're in such go society. So we definitely want to be mindful of, when we're saying those kind of things. But again, it is super important. And a lot of our mommies, if they're unable to breastfeed, they can hopefully at least pump and then feed the breast milk in the bottle, which is wonderful. So, it's delicate, but it's so important too. Again, lower allergy rate for babies that are breastfed. So there's lots of reasonings to be able to, encourage that. And that's where we're kind of at with those tethered oral tissues, being able to set them up for success. And when we're talking about tethered oral tissues, it's a dyad. We're on our questionnaire that I even talk about. We also ask about mom symptoms, like how are you doing? Where are you at with things? And very few times, but over the last several years. But sometimes we release a baby just for mom, truly. Again, those are rare, but they do happen where mom is struggling so hard that when we release the baby, and again, they might not be super tethered per se, but it gets them to work as a team. And in the case, I feel that's hugely successful because again, we're able to make them successful. And that's what we're kind of there and all about.
Very good. Mm-hmm. Well, thank you.
Yes.
Thank you, Steph. I really appreciate you being here today. We've had quite the morning.
Yes.
So I really appreciate you being here and sharing all of your thoughts. And I really hope that a lot of people are going to gain a lot of great knowledge from this.
Likewise.
So we're going to close it up today. And this is The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer, Dr. Stephanie Sommer. And thank you for being on, and be well.
Yeah.